There are a number of popular ideas and beliefs that are completely false. This is in continuation of the video on myths versus the facts about hypertension. So in this video, I will be sharing with you 10 more false beliefs that people have about hypertension. Stay tuned. 1. All hypertension medications have serious side effects. The fact is this: just like any other medication, hypertension has side effects, and most of these side effects are minimal. In cases where they look severe or serious, to the individual, it is important to consult with your doctor for proper assessment and a review of your medications. Next is, if your doctor says it's white coat hypertension, then there is no need to bother, no need to worry. The fact is this: even though you may be diagnosed of white coat hypertension, it's still very important to monitor your blood pressure. This will help to really rule out the type of hypertension that you have. Next is that hypertension only affects your heart. Hypertension only affects the heart. No, no, no. There are many complications that could arise from poorly managed hypertension, and these complications could affect the brain, leading to a stroke, could affect the eyes, leading to hypertensive retinopathy, even complete blindness. It could be a cause of glaucoma, even cataracts, and then it could affect the kidneys. That is for poorly managed or controlled blood pressure. However, you can, as much as possible, avoid developing any of these complications by having a good control of your blood pressure. I did a video on how to achieve good blood pressure control in 3 ways. You can watch that video at the end of this video. You will find it very useful. Next point is that you should avoid all kinds of fats because of hypertension. Even though hypertension could also develop from some other metabolic disorders like fat metabolism disorder, people with high levels of cholesterol, bad cholesterol, are at risk of developing hypertension. However, consumption of healthy fats as found in nuts and avocados are essential and good for the management of this medical condition. Next, you can take any type of supplements to deal with hypertension. The fact is this, that there are definitely some supplements that may be useful in the management of hypertension, like supplements containing omega-3 fatty acids are essential, especially in people with comorbidities, that is, having some related medical conditions that could worsen the hypertension. However, you cannot and you should not actually use any supplements without first consulting with your doctor for necessary review and recommendations. Next, once diagnosed, hypertension is permanent. Even though in many cases a diagnosis of hypertension may mean that an individual needs to be on medication for life. However, there are certain situations where the development of hypertension is temporary. The diagnosis may be temporary in some conditions, like during pregnancy. Some people develop hypertension and this may get to be resolved even before or after delivery. So such individuals may need monitoring. A good control with lifestyle modifications, dietary modifications, exercising can help to have a good control and even stop hypertension. There is something called dietary approach to stopping hypertension. This well applies in such situations. By the way, have you subscribed to my channel? If you are finding this video informative, educational, and helpful, kindly subscribe right now so that you can get notifications when I upload related videos and other health related videos. And when I come up live, you will also get notifications so that we can remain connected and grow together in this healthy community. Thank you for subscribing. Another false belief is that you don't need to monitor or check your blood pressure regularly. This is false because it is important to do a regular check of your blood pressure. Many factors are responsible for changes in blood pressure, including the genetic factor, environmental factor. So it is multifactorial. It is important to check regularly so that at any point there could be a borderline whereby the individual is tending towards developing hypertension, which can actually be arrested early enough with lifestyle modification, dietary changes, and exercise. Next, another false belief is that hypertension only affects people with unhealthy lifestyle. Even though this is one of the causes of hypertension, the risk factor, poor lifestyle. However, people who eat good meals, balanced diet, and even exercise can develop hypertension. This is because there are other causes of hypertension apart from genetics and environmental factors. Individuals with certain medical conditions like polycystic kidney disease, cyst collections on the kidneys, multiple kidneys, predispose an individual to developing hypertension. Other risk factors include obesity, diabetes. So it is not just about the lifestyle or the dietary changes. Other intrinsic factors could result into an individual developing hypertension. One very common question from people who are diagnosed of hypertension is, "Doctor, is there no cure for this condition? Can we get a cure?" Some people believe that hypertension can be cured. There is nothing impossible actually, especially with God and the one that believes. However, medically speaking, hypertension is a diagnosis of a lifetime usually and requires ongoing treatment, that is management, and proper management will help to prevent complications. An additional note is this: your medications do not need food before you take them. That means that you can take your antihypertensives with or without food. Because I find out from interacting with patients, people say, "I am yet to use my drug because I am yet to eat." Even though food is good, food is helpful for some medications to take their effect on the body. However, antihypertensives do not actually need food to have their effect on your blood pressure. Finally, the last point on false beliefs about hypertension is that antihypertensives are addictive. This is not true. Many of these medications are not addictive. They actually help to control your blood pressure. So do not say you want to avoid your medications if you have been diagnosed of hypertension and placed on medications, even though your doctor will also recommend lifestyle changes, dietary modifications, and exercises that will help in the control of your blood pressure. Thank you for watching. I hope you learned one or two things from this video, do well to subscribe. Remember to click on the notification bell so that you can get notifications when I come up with another video or come up live where I share practical tips on health, wellness, and lifestyle. Thank you once again for watching, for subscribing. Do well to share this video with someone out there, and I am sure they will thank you for it. See you in my next video. Bye for now.